Talopa. Hello to Bruna and Carla, Courtney and Fumi, Kiora to Hamidullah, Joan and Latosha, Malik, Omar and Stephanie. Bonsoir to Beza and Anna and Malik and Juliana. Wenya to Kioma and Courtney. And to those of you joining us via recording, welcome to the OUM community. I'm Associate Professor Nicolette McGuire-Carter, and I'm OUM's Associate Dean for Student Engagement. And if we haven't had a chance to meet before in this webinar series, I'm so glad you're here. And I'm very much looking forward to talking with each of you about our USMLE pathway. So throughout the session, you're welcome to ask questions. You can use the Q&A box. You can also raise a hand if you'd like to take the microphone and ask your question live. And we also have a few questions that have been submitted through our registration form that we'll cover today. So I'm joining you today from rural tiny Ontario in Canada. And we at OUM, we have students from here in Canada as well as the United States. And we also serve students in Australia, Aotearoa, New Zealand, Samoa, and American Samoa. So our USMLE pathway is for our students in North America. We also have a dean for Northern Hemisphere that looks after our students that are on the USMLE pathway. So if you are a student or a prospective student and you're interested in OUM and you are resident in Australia, Aotearoa, New Zealand, or Samoa, you may be more interested to attend our webinar on the standard pathway explained. If you are resident in one of those countries and you're hoping to gain licensure or have residency or otherwise practice in the United States or Canada, then stick around. And this webinar is for you as well. So on our first slide, we have a picture of our clinical site in Apia, Samoa. And I also have Samoa in the background behind me here. So OUM is a medical school who is situated in Apia, Samoa. And our clinical hospital there is Tupua Tamasese Mea Ole Hospital in Apia. And the picture here, you can see our Deputy Vice Chancellor, our founder and chairman, and our Vice Chancellor with Mr. and Mrs. Tamasese on their most recent visit to Samoa, which happened a few months ago. So we have really deep ties to the islands of Samoa, and all of our students are able to do a clinical rotation in Samoa, which gives them an unparalleled access to not only the beautiful island setting that you can see behind me, but gives them unparalleled access to hands-on clinical experience and teaching at that hospital. So we're very proud of our connections to Samoa and of being a university that provides for students who are wanting to serve the underserved areas in Oceania and beyond, and for students who have barriers that may otherwise prevent them from being able to pursue their dreams of becoming a medical doctor. So in terms of our USMLE pathway, I want to welcome each of you to this discussion by saying talofa afiomai, which just means you're very welcome here. On our next slide, it's a little bit dense with the information about our USMLE pathway. So I want to make sure that you know that this is an open space for you to ask questions. And although I want you to have that information about what it's going to be like going through the USMLE pathway, At OUM, you're also welcome to engage in discussion with me during that time point. So don't feel too overwhelmed by all of the words on the slide, but you're also welcome to take screenshots of this, as this information will be helpful as you make your decisions about the right medical school for you along your medical student journey. And if you would like access to this slide deck so that you can go to some of these links that are hyperlinked here, you can connect with one of your admissions counselors. So for most of you in North America, that will be Camille Dahl, who is our admissions counselor for the Northern Hemisphere. And if you are a student that is located in Australia, Aotearoa, New Zealand, or Samoa, but you're interested in the USMLE pathway, your admissions counselor is Ms. Shanda Gordon. So in order to get in touch with an admissions counselor, if you haven't already, there's just a button on our website that just says find out more or talk to us. And don't be afraid of clicking that button, because Ms. Camille and Ms. Shanda are just wonderful, lovely people, and they love answering your questions and chatting with you. It makes their day if they can be talking on the phone or connecting with students rather than be doing paperwork and things on the computer. So never feel nervous about reaching out. They are there for you. And if you'd like an introduction to Ms. Camille or Ms. Shanda, our last webinar was our admissions information session, and the two of them joined me for that webinar, so you can get a better sense of who they are and how they're quite nice people to chat with. Okay, so let's talk a little bit about what it would be like for a student in North America to go through medical school at OUM in order to prepare for licensure requirements in the United States and in Canada. So OUM is an accredited medical school, or accredited by an accrediting body called PASCU, which is recognized by WFME, the World Federation for Medical Education. So within the United States and Canada, medical schools have to be accredited by an accreditor that is recognized by WFME in order to be eligible for licensure pathways. So all international medical graduates receive certifications through a pathway from ECFMG, the credentialing foundation for medical graduates. So when you are doing your research about what medical school might be right for you, just make sure that your medical school is listed in the World Directory for Medical Education, and is also listed as is also accredited by a body that is accredited by WFME. Otherwise, you may have problems when you go through to get your licensure. So you don't have that problem with OUM. We are accredited by PASCU, which is accredited by WFME. So that makes you eligible for the ECFMG pathway 3 for residency. So that's the end here. So what does it take to get to that point? Okay, so at OUM, our curriculum is split into 3 phases. There is a preclinical phase, a clinical transition phase, and a clinical phase. So the preclinical phase is what you start with first. So it's about 2 years to 2.5 years of units. We call these our medical science units. There are 10 of them. So all students at OUM start with a class called General Principles, and that ensures that no matter if you've just come out of your undergraduate degree with all of your pre-medical requisites, or whether you have been practicing in healthcare and nursing or paramedics or some other health profession for the last few years and have been out of university for a while, or whether you've been in engineering or teaching or business and you've been haven't taken prerequisite science courses in a while. It gets everybody on the same footing to be able to know the basics of things like cell biology and genetics in order to do well in their medical sciences units. So after general principles, you have the rest of the 10 medical science units. So we have a systems-based curriculum where you take one class at a time. So after general principles, you take cardiovascular system, then urinary system, then pulmonary system, endocrine system, nervous system, heme immune, gastrointestinal system, and musculoskeletal and integumentary system. I think I've got all those, all 10 of those. If I've missed one, let me know in the Q&A box and I'll go back through in my mind. So those are your medical science units. At the end of the medical science units, you go into the clinical transition phase. So in the clinical transition phase, we have two classes. We call them CTU1 and CTU2. So both of those are 8-week classes, but they are self-paced, so you can take up to 16 weeks to do them. So the purpose of those classes is basically to take the information that you learn in the medical sciences units and translate it into how you will act once you get into your clinical rotations. So it has things about professionalism and ethics and family medicine and internal medicine and so on and so forth to just get you ready for safetiness to be on your clinical rotations. The clinical transition units and the medical science units are taught in a flipped classroom model. So they're student-led and student-directed, but there are a number of what we call our SCORMs. So there are recorded lectures with associated readings. All of the readings are available in Clinical Key, which is our library, so you don't have to purchase any textbooks separately. Your annual subscription to Clinical Key is included in your tuition fees. So same thing in the clinical transition units. You have these SCORMs, which are recorded lectures as well as reading assignments. And there are one-to-one sessions that are offered with the course director in order to get you prepared for things like the patient encounter, history taking, review of systems, that sort of thing. At the end of the clinical transition units, there is an in-person session where you learn things like all kinds of different hands-on clinical skills. So things like suturing, injections, all that fun stuff happens within the clinical transition unit. So for students who are on the USMLE pathway, they need to complete the USMLE. So USMLE stands for United States Medical Licensure Exam, and there's actually 3 steps to the medical licensure exam. So in North America, students take the USMLE Step 1 during the clinical transition phase. So all students that are in the USMLE pathway are enrolled in our USMLE Step 1 prep course. There is no additional tuition and fees for this course. It has a number of outside resources. So there are recorded review type videos and SCORMs, and then there's also access to a question bank for preparation. And then there are weekly sessions with a facilitator that include others who are taking the USMLE Step 1 prep course along with you. At the end of your prep course, you'll take the National Board of Medical Examiners Comprehensive Basic Science Exam, or CBSE. So there's a link for that there. You can also Google that while we're chatting about it. So the Comprehensive Basic Science Exam is a preparatory exam for the USMLE Step 1. So when you take the CBSE, it generates for you a report that gives you your statistics about how close you are to being at a passing grade for the USMLE Step 1. And it gives you your areas of strength and weakness, as well as some specific feedback in the different areas that you'll be tested on in the USMLE Step 1. So when you take the CBSE, it'll let you know, are you ready to take the USMLE within the next few weeks? Or do you need to go back and study a few different areas, revise a bit, and then take the CBSE again in another 4 weeks? So all our students who are in our USMLE prep program take the CBSE so that they know that they're ready to take the USMLE Step 1 exam. So at the end of the USMLE Step 1 prep program, you will be scheduled for your USMLE Step 1 exam, and you will pass that exam because you have completed all the prerequisites to do that, and you have taken the preparatory exams that let you know that you're in good standing to pass that exam. Once you finish your Step 1 exam, you'll then go back to your clinical transition units and complete Clinical Transition Unit 2. That's the one that has that in-person component. After you complete your CTU2, you then get to start what is typically the favorite phase of all medical students at OUM and probably elsewhere as well, which is the clinical rotations. So we call that our clinical phase. Okay, so after you finish Step 1, you go right into your clinical phase and you can start clinical rotations. So OUM, like other medical schools, has a specific number of weeks that you must take and complete clinical rotations in order to ensure that you have readiness for safe practice as a medical resident. So, for example, all students must take a set of core rotations. And then they also take a set of elective rotations that are in medical specialties in their areas of interest. We encourage students, when you're going into your clinical rotations, you should treat that like a job interview and should show up like you are a doctor and that you are wanting to practice in that area, because you're going to be assessed on your medical knowledge, on your professionalism, on your clinical skills, on your critical thinking, on your ability to work with and be safe in a patient-oriented setting during your clinical rotation. So most of our students will start with community and family medicine, and then there's no specific stepwise pathway about what rotations you need to do in what order. So some of that is up to the student's choice as well. So other rotations include things like other core rotations include things like internal medicine and surgery, pediatrics, and psychiatry. And the electives include things like dermatology, cardiology, anesthesiology, sports medicine, and so on. Okay, so our 72 weeks of rotations in total. We do encourage students to take a couple of weeks in between each rotation, because in addition to being on site at the clinical rotation, you do have some class requirements as well. So we have our students writing up case studies and doing logbooks, and also taking examinations in their core clinical rotations to ensure that they have readiness for their Step 2. So at the end of your core rotations, you can enter the USMLE Step 2 prep course. So this has a similar structure to the Step 1 prep course, but it takes a little bit less time than the USMLE Step 1 prep course does. So again, it has access to subscriptions with outside resources that include practice questions, as well as review videos and review materials. And you also are supported by a facilitator that's available to you on a daily basis, but also has live sessions that are run on a weekly basis. At the end of your USMLE Step 2 prep course, you take the NBME Comprehensive Clinical Science exam. And just like the CBSE up here, the CCSE measures your readiness for taking this USMLE Step 2 exam. So we really want to ensure that our students are not going into their licensure exams not being ready to pass and do well on those exams. So Step 1 is doesn't give you a number grade, it's a pass-fail, whereas Step 2, you get a number associated with your performance on that exam. So we want to make sure our students are performing very well on that exam. So that's why we have this prep course as well as the Comprehensive Clinical Science exam. Once you are through the prep course and you've taken the CCSE, you then are ready to take the USMLE Step 2 exam, and you'll be cleared to do that and assigned a date by the NBME, the National Board of Medical Examiners. If you are in Canada, You may also opt to take the MCCQE, which is the Medical Council of Canada qualifying exam, which you will also be prepared for. So we encourage students who are in Canada and wanting to practice in Canada to take both the Step 2 as well as the MCCQE so that you're eligible for the match processes for residency in both the United States as well as in Canada. Okay, so after you complete your Step 2 and or your MCCQE, you can go into your elective rotations. And all students at OUM take at least one rotation in Samoa. Sometimes they take a core rotation in Samoa, and sometimes they will take an elective rotation. It's really up to the student and their own interest. The two most popular rotations in Samoa are psychiatry and OBGYN, but also cardiology is becoming quite a popular elective in Samoa as well. So as I said earlier, there's lots of incredible hands-on experience that you will gain there, as well as the clinical reasoning skills that Samoan doctors have are just unparalleled in terms of what they're able to do with the facilities and equipment that they have. So students do come back from that reporting about just being able to have that experience of how different things are from their home country's medical system versus the Samoan medical system, how medicine is practiced differently, and the different types of cases that they see in Samoa versus their home country. So we do see this as a very positive experience for students. And also it's a very positive experience for the people and the medical system and the government of Samoa, because we are providing some additional medical expertise and medical care in that area. And some of our students do elect to stay in Samoa and become interns in Samoa rather than within their home country. So we have a couple of students who've just graduated and who have stayed in Samoa for their residencies in internal medicine and in psychiatry. After the completion of your elective rotations, for students in the US, you will take what we lovingly refer to as the OSCE, which is an objective structured clinical examination. So you have patient actors and clinical observers that basically you go into a room, you get a stem, and then you have to perform some aspect of patient care with your patient actor. And there are different stations that you go through in your OSCE. And then you get feedback on each station and how you've performed. So students in the US take the OSCE, and students in Canada take the NAC, which is also an OSCE, but it's a nationally offered exam. So they don't need to take the OUM offered OSCE, they can take their NAC instead. After the OSCE and the NAC, you will have, and plus these and your research requirement, you have completed the requirements for your degree, and you can be promoted to being eligible for graduation. And then there's a whole set of paperwork that is filled out for you with the dean's office to make you eligible for residency in the match if you are in the US, and CARMS if you are in Canada, or you're also eligible for the match if you are in Canada. And if you are in the US and you have residency status in Canada, you're also eligible for CARMS as well. Through the ECFMG Pathway 3, which is for students who are international medical graduates of institutions that are accredited by WFME. So that's a little bit about the USMLE pathway explained. It seems like there's just like a lot of exams and a lot of hurdles to go through. I promise it won't feel like that when you are going through medical school. Instead of feeling like there's 10 to 12 things that you have to get through over 4.5, 5 years, it's going to feel like you have a hurdle to go through every day. No one is of the opinion that medical school is going to be easy. and that it's going to be without struggle. And I would say actually sometimes the exams are the easy part of medicine and of getting through medical school. It can be really challenging to put your brain and body and emotions through a very intensive academic program, such as medical school, and particularly when you get into clinical rotations and you're starting to apply that hard-earned knowledge with patients. You are exercising your empathy and professionalism and flexing those muscles in a way that you may not have before. You have a level of responsibility that you may never have had in the past. And with that responsibility sometimes comes, additional stressors and additional things to think about, things that keep you up at night. So one of the things to think about when you're considering medical school is, am I someone who's a lifelong learner? Is this what I want my life to be like? Because medical school is really just the start. Once you graduate and gain a residency, you're learning every day in that residency as well. Once you gain full licensure, you're learning something new every single day. So you really have to be driven by the science and knowledge of medicine, as well as the art of practicing empathy and care in order to be successful in a career like this. And I want you to know that we at OUM have students from many different types of backgrounds that meet those kinds of milestones. So there's not one specific level of schooling or one specific profession that you've had to have experience in the past that makes you good at those things or makes you ill-suited for this. What you really need to have is that motivation and drive to be a lifelong learner, to be someone that's committed to doing that on a daily basis, as well as for the rest of your life, and someone who's committed to the selfless pursuit of that in terms of having the ability to use that to support others. One of the things that we work on a lot with our medical students as well is ensuring that they have a really good support system as they go through this. So not only are they outwardly focused on the application of knowledge for the good of patient care, but they're also inwardly focused so they can continue to practice self-care and to cultivate their own bodies and minds around the practice of medicine. So think about that this is not just an academic program, this is a lifestyle change and something that really becomes part of who you are. And maybe you've had this niggling feeling in yourself for a really long time, maybe as long as you can remember, that this is who you are and that you haven't yet had the chance to go through a program like this to become who you are. And you've tried to silence that voice. And you've tried to do other things, pursue other passions, pursue other careers, try to do other learning and engage your brain in that, but still this niggly feeling in the base of your chest, in the bottom of your heart, in the back of your head will not go away, that this is the pathway for you. So if you have that feeling, if that feeling is there, I can tell you that that feeling will stay there and that feeling will serve you well in a program like this and in a pursuit like this. I see that there is a question posed in the Q&A, and it's from Anonymous. Hi, Anonymous. Would OUM consider or have plans to set up clinical rotations 2 years near or in outskirts of Dallas, Fort Worth, or Houston area? Anonymous, I just want you to know that we have lots of students in the Dallas, Fort Worth, and Houston area. And although I'm located here in Canada, I'm actually born in Dallas. And this is a question that we get fairly frequently, which is not just related to the Dallas, Fort Worth, and Houston area, but students want to know, can I do my clinical rotations in my state or province? And where does OUM hold clinical rotations? I would say in the past 4 years of doing this webinar, that's probably the most popular question that I get. So if you, Anonymous, are maybe Ernest or Fumi or Greta or Hamidullah or Joan or Juliana or Latosha or Lawrence or Malik or Omar or Shelly or Shanika or Stephanie or Vanette maybe have this question too. Maybe those of you listening via recording have this question too. Okay, so can you do your clinical rotations in your state and province? So the answer is neither yes nor no. How OUM does rotations is that we always have a dedicated clinical site in North America that we encourage students to go travel to do their rotations there. So we have in the past had dedicated clinical sites in Texas, in Illinois, in West Virginia. And in addition to our dedicated clinical site, we also will work individually with students in order to seek approvals and seek contracts at particular educational and clinical institutions. So it's really important to us that our students have a really high standard for teaching and learning in their clinical rotations. So students may have a connection with a local hospital or may just really would like to rotate in their local hospital, that maybe they have a real interest in anesthesiology and that's the best anesthesiology program in the state. And so they really want to try to do their rotations there. So in those types of cases, we have a clinical rotations administrative officer, as well as our dean for the Northern Hemisphere, that when you identify a site, they will work directly with the site to see if we can set up an agreement with that clinical site for you specifically. So we cannot tell you what will happen in 2 or 4 years' time about whether we would be able to have an agreement with a particular hospital or at a particular site. And the reason for that is that lots of different medical schools do this. They set up clinical sites in the areas where their students would like to do clinical rotations. And sometimes medical schools will do things like have a non-compete clause in their agreements so that for a certain number of years, only that medical school students can rotate there. OUM does that too. So it's not unique to other types of medical schools. So we can't guarantee that you'll have specific rotations at a specific clinical site because we cannot predict the future of the types of agreements and the timelines that clinical sites will sign for those agreements. For having medical students there. We only make the promise that we continue with all of the students that we enroll in North America, that they are able to identify sites that they would like to do their rotations, and that we will reach out to those sites and try to put agreements in place. We cannot make any guarantees about those particular agreements. So I hope that helps. We do encourage all students when they consider enrolling at OUM to know that you will need to travel during your clinical rotations. So either you'll travel to our dedicated site to do some of your rotations. You may be able to do some rotations at your site of choice, but you definitely will also have to travel to your clinical rotation in Samoa. So do plan for travel time during the clinical phase of the program. Okay. Vanette wanted to know, are there a lot of residency matches in the New Jersey, US area? And I'm just going to see if there's any more questions about any of the other areas in the US. Okay. So I don't have the data about the specific states for our residency matches. I actually don't think we have any from New Jersey in our last match year, but it's possible that we would have had students matching in New Jersey prior to that. We do have a high success rate for our students being able to get a residency match in their home state. So many of our students do ultimately gain a match for residency in their home state, but I can't make any guarantees that you'll be able to match in your home state. The best way to get a residency match in an area of your choice is to ensure that you are doing a clinical rotation in that area and that you get to know the people whilst you are there, that you're making good connections. Many of our students will also attend annual conferences like the American Medical Student Association conference and get to know some of the residency coordinators at those conferences, because when you have a chance to meet people in person, you can see if that program is going to be a good match for you. So one of the things to think about is not just, am I going to be able to find a match? But am I going to be able to find the match that's right for me? So you want to be thinking about the right match for you, not just getting a match, but what is the right program for you? What is the right type of residency for you? And thinking about that as you start the program and all the way through, and making sure you're taking the steps to make the right connections to increase the chances of getting that match. Okay. Do clinical sites cost students independently from the college tuition? So in the past 5 years or so, we've seen an increasing amount of clinical sites charging weekly for students to attend their clinical rotations. So right now, in the United States, in Australia, and in New Zealand, there are fees for students to attend weekly their clinical rotations. One of the things that we do when we are putting together the agreements with clinical sites is that we negotiate those fees to make sure that they are as low as possible. So that's why we don't encourage students trying to negotiate with clinical sites independently, because we'll end up with higher fees related to that. So if you want a little bit more information about the costs of the program, the cost for tuition, the cost for fees, the clinical site fees, the behavioral fees, we have another webinar coming up in a couple of weeks with our Chief Financial Officer and Bursar, Ms. Susie Robertson. So she'll have a lot more information, and she'll have a number of slides that kind of go through the different types of payment plans, how much tuition credits cost, the kinds of fees that you can expect throughout the program. And we really do pride ourselves on how transparent we are about our tuition and fees and the costs for attending the program, because we really want to make sure that when you make the decision to go to medical school, that you have all the information in front of you. And also because we are a smaller medical school with smaller incoming classes, so our last incoming class that entered in July 2026, we had 57 students. So we want to make sure when students enter our program that those are the 57 students that are going to be graduating from our program as well. So we want to make sure that you have as much information as you can up front, so you feel really comfortable with the decision that you're making to come to OUM, because once you're here, we want to hang on to you. We want to see you finish the program. Okay. And Fumi wants to know, what happens if you pass USMLE step 1, but not step 2? So you must pass USMLE step 1 in order to start clinical rotations in the United States. So if you pass step 1, that's great. You can start your clinical rotations. And then in terms of going into step 2, you are able to take your licensure exams more than once. However, that's heavily discouraged. So that is the reason why we have students taking the clinical sciences exam prior to taking their step 2, so that they are at the right level of preparation before they register to sit the step 2. And then Fumi wanted me to cover tuition and payment plans again. But if you need that information today, I would say to go back on YouTube. There's a posted video that Ms. Susie did earlier this year. It won't have the updated tuition and fees that will be the ones for 2027. But if you need that information directly right away, that's the best place to go. And if you can wait a couple of weeks, we'll have the up-to-date information for the January 2027 incoming class in terms of tuition and fees and the payment plan options. Okay, and Greta wants to know, I'm wondering what the overall attrition rate is for North American students, as in, do you have any data on how many students start the program and are accepted into a residency program on the first match? So we do publish our match rates every year, but there are some caveats about how we define match rate success. So just be careful about this when you're looking at match rate success from different medical schools, because everyone defines that slightly differently. So make sure that you look up the definition for what that medical school is posting, their success rate. They should post that on their website as well, so you feel fully aware about that. So I don't want to give that match rate without that caveat, but it is posted on the website about our residency match rates. And I believe we have data over the past 2 years. It's available on the website. And in addition to the prep programs that I was mentioning for USMLE Step 1 and Step 2, our Chief Academic Officer's Office hosts a residency series. So there's basically a year-long series that provides like preparatory activities and materials for being in the residency match. So it has things like preparing for your interview, how to write your various forms and documentation for getting into the match, how to make connections with residency supervisors, how to make sure that you are presenting yourself in the best way possible. So that residency series has been rated really highly by our students in terms of helping them to have an increased comfort level when they do start to go through the match and when they're entering interviews. So we have a smaller number of North American students compared to our Australian, Aotearoa, New Zealand, and Samoan students, but we do have a really high match rate for our students because of the preparatory programs that we put everyone through and because of our residency match series. Okay, Omar wants to know, does the student ask the hospital clinic site director about being able to rotate at that site, or do we have to request OUM to make that request? So students are welcome to speak with particular individuals at their hospital of interest, but they can't make or sign any agreements with the site. So let's say you are a nurse and you work in an emergency department at your local hospital, and you know the clinical site director there, and you ask them, can I do my clinical rotations here? And the clinic site director says, we really love all the work that you do here as a nurse. We'd love to have you. So that would be the point where then you turn that information over to the university and ask us to step in, because you don't make a rotation agreement with one individual at the site. It's an agreement between the university and the site itself. So our dean's office takes care of those types of agreements. So we have to take care of things like making sure you're going to be safe on site. Are you making sure your insurance is in place, making sure that they are set up to house you and give you the appropriate number of clinical hours in order to satisfy the requirements for that rotation. So it's not as easy as just approaching someone and saying, can I come here for rotations? There's a number of steps that are in place to ensure that you have a good and well-rounded education at the appropriate standard and level. Okay, Fumi wants to know, do we have residency matches in California, Arizona, Guam, or Hawaii? I don't know about Guam, but I do know we have graduates who have matched in California, Arizona, and Hawaii. I don't think so with Guam, but it might make sense. We may have some students, former students who may have done some clinical experiences in Guam. Okay. Anonymous is asking a few things about New York State amendments. I can't answer those kinds of questions. What you would want to do is to go into the licensure board for the state of New York and look at what they accept in terms of their ECFMG requirements and international medical graduates and be satisfied that OUM would meet those types of requirements. So I don't have enough information to answer questions about the individual state legislative requirements and also those policies and the laws will change over time. So I can't make a determination today about what you will be eligible for based on the information that's there, because I simply just don't have enough information about each state to be able to speak to that. Okay. Oh, Anonymous, this is a good question. And I don't see this one too often. What is the biggest reason that people drop out? And do we keep data on that? Absolutely, we do, because we don't want students to drop out. Part of my role in student engagement is to be a student support advocate and to ensure that students have the things that they need to do well in the program. So in my office in particular, I don't like to see students who leave the program. So we do pride ourselves on the level of student support that we're able to provide and our ability over the last 5 years to reduce our attrition rates. So for example, we at OUM, you are allowed to take up to 12 months of leave of absence, and you can take that for any reason. So if you have a personal situation that's going to take a number of months to resolve, and it wasn't something that you were kind of planning on happening, it just occurred. Let's say you are a student who was planning to work during your degree and your hours were cut, or you lost your job and you need to take a short leave in order to get your finances in order. So we do allow our students to take up to 12 months of leave. And that can be taken continuously or broken apart throughout the degree. So that does cut down on the number of students who have to leave the program for short-term changes in their environment or in their environmental situation and needs. We also have an accommodations, equity, and inclusion program. So we have a large number of students who have accommodations for medical conditions or disability needs when they have functional limitations for the completion of the program. And that also helps decrease our attrition rate, because we are not losing students due to lack of academic progression or failure because they have the support they need. They're accommodated in order to remain in the program. So I would say that the biggest reason that people do leave the program is that they have a financial issue that was unexpected that occurs after they've started their degree. So some people will have a financial issue. They'll take leave, continue to take leave until they max out at the 12 months, and then they have not been able to resolve their financial situation. And so they have to withdraw from the program. We do allow students to re-enter the program after withdrawal. So you can apply for readmittance to the program within a prescribed period of time after you've left the program. And then our academic board will assess your state prior to leaving the program, and then will allow you to re-enter at the appropriate level when you return. So that's the biggest reason why students leave the program, is really due to financial matters not being resolved. And we do keep data on that. We have a student information system that's bespoke to the university, so we keep data on what we consider high risk, not behavior, but high risk for having to leave the program. So students that are maxing out on their leave, for example, are high risk. And we will go in and connect with them, support them. The bursar will talk with them about payment plans. We'll just see if there are additional things and services that they may need in order to remain in the program and continue with their academic progression, even if they need a short time away. Okay. I want to answer this question right now, which is, because I'm talking about financial being a reason why students leave the program, which is, does OUM offer financial aid assistance? No, we do not. We are currently accepted under or certified under Alberta Student Aid in Canada. However, there are some things changing within the provinces and within the federal government in Canada, where some international universities will no longer be eligible for student aid. So I would encourage you, if you are in Canada and you're looking at your student aid options, to just look into if your province or territory is affected by that. We don't offer any financial aid assistance in the US. There's some rules under the NCAME, MAE, where the accrediting body is not listed under that. We hope over the next few years that the US may transition away from having their own accrediting body of accreditors and just to take the accreditations that are done by the WFME, which is the World Federation, but currently they don't do that. There's an internal body within the US, so we're not eligible for our students are not eligible for federal assistance in the US. Vanette wanted to know, thinking on planning ahead, is it safe to say the whole program would take roughly 7 years, including residency, if all exams are passed successfully and all other requirements are met? The estimate that we give is 4.5 to 5 years. So we don't include residency as part of our program because you take your residency after you've graduated from medical school. So with the step 1 and step 2, it's the estimate's around 5 years for the program. And that includes the time that you start in general principles till you take your OSCE or NAC exam. Omar says, I've been a DC-based primary care PA for 25 years. Go, Omar. And I have no interest in doing surgery as I want to continue my work in primary care, but as an MD, is there a way that the 12-week surgery rotation can be truncated or exchanged for an extended primary care rotation? So right now, surgery is a core clinical rotation, so you must complete the surgery rotation as part of your clinical rotations. Even if you have no interest in surgery, maybe you'll get into an area where you will hate it. You will hate it, but you will learn some new things and you will be able to apply those things to primary care. So even if you don't have an interest in that area, there's still an opportunity for you to learn things, even if you learn things that you don't think that you would like to see or apply in practice, that's still a good learning experience. So OUM and other medical schools as well will require surgery as a core rotation. Anonymous wants to know, are there payment plans available? Yes, there are. There are 3 different ways to pay for your tuition credits at OUM. And Ms. Susie will talk about each of those in more detail, and she'll run through with some examples at our webinar in about 2 weeks' time. Anonymous wants to know, for those in the United States that will be relocating to another country, will we be able to continue our education with OUM? So if you are planning to relocate, like let's say you are a citizen of the United States, but maybe you're relocating temporarily, maybe for military service or something like that, or a family member in military service and you've got to be posted somewhere else for 18 months. it's completely fine for you to be able to complete your preclinical requirements outside the United States. However, when you go into clinical rotations, it'll be very difficult for you to complete the clinical phase of the program if you're outside one of the countries that OUM serves, because we won't be able to offer you clinical rotations outside that site. Now, that said, we do actually have a global plan for clinical rotations where we will in the future be offering clinical rotations at additional sites outside of our 5 jurisdictions, but I can't speak on those yet as those plans have not yet been implemented. So I won't be able to answer any specific questions about whether the country that you're going to is one that we'll be able to serve, but there will be additional international opportunities beyond Samoa for our students in the coming future. Anonymous also wants to know, can the program be completed in less than 5 years? We do have students who have completed the program in less than 5 years. For those on the USMLE pathway, the way to decrease the time spent in the program is there's sort of 2 ways. The first is to reduce the amount of time that you need to spend in the USMLE prep programs, because that time is variable. As soon as you can pass your NBME exams, you can get out of the prep program and take the STEP exams. And the second way that you can reduce your time in the program is to not take that recommended 2-week time period between each of your clinical rotations. So we do have students who take their rotations back to back. We have had students that have completed in less than 5 years on a more accelerated time frame. But I would recommend that you plan to be in the program for 5 years in case there are things that change in your environment that are sort of outside your control, and in case you need that additional time in the prep programs in order to be successful in your licensure exams. And Malik also wanted to know, can the USMLE pathway be completed in 4.5 years or less? We have had students that have completed it in a shorter period of time, and they've done it the ways that I've just explained. Okay, Greta wants to know, I'm doing so good with the Q&A this time. Those of you who attend these sessions on a regular basis know that I don't always get through the Q&A, but I think I've got to the last one this time. So Greta wants to know, you allow students to work part-time. Do you keep data on how many hours students work on average in their first 2 years if they choose to work? I'm also aware that students vary on their abilities. Okay, so this is the recommendation that I would give to you. Yes, we do have students who work during their preclinical phase. It's not possible for students to work during their clinical phase because they have to have regular clinical hours, and most individuals can't abide a full-time schedule with a separate job when they have to be in clinic full-time Monday to Friday. For the preclinical program, we do have some students that work part-time because those medical science classes are all done through SCORMS and through Zoom, which is the same platform we're using right now. We recommend that when students begin general principles, that they take the first few weeks off of work and just focus on general principles. And then as they get more comfortable with the pace and level of material that they're being asked to go through in medical school, that they add hours back in. So we do have students who work up to 20, 30 hours a week in the preclinicals. I definitely wouldn't recommend planning to work 20 to 30 hours a week during the preclinicals. We have students that do that successfully, that are very well organized and maybe don't have a lower amount of sleep that is required and have very supportive families, but it wouldn't be something that I would recommend to all students. Okay, we are at the top of the hour. So I want to thank each and every one of you for joining us for this session on the USMLE Pathway Explained. Here's a little bit of information about the last incoming class. So maybe you'll be part of our January 2027 incoming cohort. We have our next deadline for applications, which is coming up in a few weeks. So if you have some remaining questions about your application, application. And before you finish your application, I do recommend and really highly encourage you to reach out to your admissions counselor and also to join myself and Miss Susie in a couple of weeks at the financial webinar coming up then, which you can register for on the website or via your admissions counselor. So Fafatai Lava, thank you very much for joining me today, and see you all again in a few weeks. Bye for now.